Hello, my name is Lucine, and today I'll be talking about digital marketing in healthcare. Let's understand what is digital marketing itself. Digital marketing refers to advertising via digital channels, and those channels can be mobile apps, can be social media, or engine search. So we're going to be reviewing 7 different types of digital marketing. Search engine optimization, search engine marketing, pay-per-click advertising, content marketing, social media marketing, email marketing, and affiliate marketing. Let's start with search engine optimization, which also shortly called SEO. Search engine optimization is widely used in healthcare as well as in everyday any people's life. So before we schedule any appointment in doctor's appointment, we usually search for the content or some information regarding providers prior scheduling an appointment. Search engine optimization provides a current data when we put some phrase in the search engine, the search engine optimization ranking the phrases that people are looking for and helps you find a right website. However, it has its pros and cons. Some pros are essential for online business, which helps to stay up to date. Optimize a website to maximize its chances of ranking. Advice on medical problems. Sometimes it gives, or often it gives, a really accurate advice on any medical problem that we can search for. And it's also a great way to edge out the competitors. Some cons are limited information. It's not always that we can find all the detailed information via engine search. It also time consuming. It depends what we're searching for. Has big investments for a competitive niche. Risk of being penalized and not full control. So we don't have full control of search engine optimization. So next type of digital marketing we're going to review is search engine marketing, or SEM. So search engine marketing is a heart of any solid digital campaign. Pay-per-click also includes here, but we're going to talk about that in my next slide. For example, if a user uses a Google search and types any keyword, the very highly targeted advertisement will gonna pop up with it. So it would my initial result, for example, whatever I'm searching for. The internet is nowadays it's a primary used engine, the digital marketing. It also widely used in healthcare because Americans use the online for health information each year. It includes medical professionals as well. So doctors and nurses are searching for some medical information via search engine marketing as well. It also has its pros and cons. Some pros are tracking a wide range of data, optimizing growing, optimizing and adapting a strategy in real time. And some cons are people using ads sometimes, using ads blocking software. So competition with Google Ads as well. Google Ads users are high as well. And another con is usually success depends on money that must be put into every click. Pay-per-click advertising. Pay-per-click advertising is basically a successful navigates a highly competitive field of healthcare advertising. First of all, pay-per-click advertising model directs traffic to websites when a viewer clicks on internet ad. So this gives us some pros and cons as well. Some pros are about 60% of visitors search for healthcare information. So we will find many people, if we walk around and keep asking people, do you use usually any of the engine search to find any medical, like healthcare information? So 60% of those will answer yes. The advertisement is also pay only at actual results. So basically, pay-per-click advertising, if we're going to use this, it's actually it will give you opportunity to pay only. So it will ask you to pay only for the actual results. So you won't pay for something if you don't get the result. Some cons are when a website fails to deliver sufficient information. Nearly 71% of visitors are lost. And another con is frequent advertising, working healthcare advertising plan. So those are two main cons that applies to pay-per-click advertising. Content marketing. What is content marketing itself? Usually, healthcare marketers should use content marketing to position their healthcare organization as leaders in a industry by publication. Basically, consumers will trust to the healthcare organization or to the provider that they can search about and find them published on the internet, right? So if I will look, for example, a dentist, right? I will search for the current dental office, and I would like to know which provider has been working there for how long, what's the rating of a provider, and if I see any publication regarding that provider, that will help me to come up with conclusion if I want to go to that for that provider or not, for that dentist or provider. So that's some of the pros. And cons are, it takes time to create quality content. Sometimes, yeah, it does. And also the learning curve and developing effective content, it also is not as easy curve. So we don't have, it all connects to the time. It's time consuming. Social media marketing. Social media, that's the most popular nowadays is the most popular way of digital marketing. So let's take, for example, of Facebook. Many people, including providers and patients, they will go on Facebook or any other social media for feedback. I'll give an example. Like if I go to the doctor and I'll be happy or opposite unhappy or unsatisfied with the service they provide, I would like to go for social media and aware people of current doctor or healthcare organization who didn't provide a good service to me, and for the other people to be aware of such a thing, or opposite, to give a good positive feedback about a particular provider or a hospital or any other healthcare organization. So basically, social media helps a lot to connect providers and the patient together. It's a good way to communicate because sometimes providers and patients are making a kind of friendship relationship via social media and being in touch for their future consultation or just future follow-up. So social media nowadays it's the most common one of the most common ones. So some pros of social media, it's a patient-provider better communication and connection. Physicians use internet to access the latest diagnosis and treatment information, and it's cost-effective way to reach patients. So we don't have to pay for that to be able to reach patients. We just need to basically type the full name to be able to find some patient or provider and make a quick connection. Some cons are there's no control over the feedback. So like I mentioned earlier, some negative feedback, unfortunately, comes via social media as well, and we have no control over those. So we just have to take it. It's kind of risk. Another risk, it's a HIPAA regulation violation. So there is no way to prevent any there's no way to keep the confidentiality via social media, basically. And it also time and effort consuming. So to be honest, social media, I'll give example of myself. I did have my Facebook closed for over 2 years because it was taking so much time of me. So it does time consuming digital marketing. So email marketing, that's the most common one because nowadays healthcare organizations, providers, patients, any future vendors We are all communicating via email. It's easy to send emails to the patients for follow-up or scheduling appointment. It's very easy and quick communication with the future candidates. We can just schedule candidates for as a future candidates, like scheduling via email. Or email provides also it like connecting with vendors to be able to schedule follow-up or sell something. It's via email. It's very quick. The pros are fast and effective, ability to communicate with patients, opportunity to schedule an interview with potential candidate, like I just mentioned, and it's cost saving. So we don't have to pay to be able to send an email. And some cons are reliability. Marketing emails might get into the spam, and one might not ever find it. They can get lost there. Reputation. Some people doesn't like to receive marketing emails. Unfortunately, that's true, but we don't always like to receive all this marketing and advertisement that gets into our inbox. Sometimes we don't even open them. We just like spam them or we delete them. So it depends. And also there is a risk of cyber attack. So via email marketing, it's not always trustful where it comes from. So people are hacking emails and sending viruses. So there is a high risk of a cyber attack. And the last, it's about affiliate marketing. So what is affiliate marketing? Affiliate marketing is basically very easy to work with. What we need basically easy to do is to sign up, follow up the rules, and promote the product. If we need to sell anything via affiliate marketing, it's easy. It's not cost effective. So it doesn't cost money. Additional source. It is additional source for as income, like it's additional revenue for healthcare organizations, because sometimes healthcare organizations need additional revenue if they're struggling financially. And to be able to use the affiliate marketing to boost the revenue, it's actually a very not very common, but it's common for some of the healthcare organizations or some of the providers, some professionals, like they commit to build and maintaining blog or websites. The affiliate marketing can help generate a revenue. Some pros are, like I said, it's additional source of income, increases chances for success, possibility to create a private deal, avoid handling customer service issues. So we don't have to worry about the customer service issues with affiliate marketing because we're not the ones who's going to deal with that. And cons are time consuming. Many of these digital marketings are time consuming, unfortunately. So it has also no control over the programs. Anyone can sign up for it, so competition is pretty high. And also false advertising is very common with affiliate marketing. So those were 7 digital marketing that we just talked about. And in conclusion, I would like to add that the digital marketing in general helps to any healthcare organization to get in touch, be connected. It helps to boost the revenue. It also it's a great resource for any healthcare information as well. So online advertisers, patient engagement, great resource for physician if they need to search any information, medical information, or also data reporting possibility. So this was about digital marketing in healthcare, and I hope you enjoyed this presentation. And on the next slide, I also have some references that I was using to create this presentation. This is all those references if you're interested. So thank you very much.